Hello and welcome to this special show on Rajya Sabha television. I'm Vishal Dahiya and here we bring you all the details of India's fight against COVID-19. Now, there is a lot of talk going on about the drugs being developed, the vaccines being developed, and obviously the rules and the guidelines for unlocking, that is the lockdown period, to bring it to an end. But one very important concept which is also being spoken about and discussed is the concept of herd immunity. What exactly is herd immunity? How does it work? And can it work in the Indian settings? For all this, we have with us a distinguished panel of guests. Let me first introduce them to you, beginning with Dr. Jugal Kishore. He is the Vice President of Indian Association of Epidemiologists. We also have with us Professor Shailendra Saxena. He is the Professor and the HOD of Center for Advanced Research at King George Medical University in Lucknow. And we also have with us Mr. RK Srivastava, former DG of Health Services with the Government of India. Welcome all of you to Rajya Sabha TV studios. And let me begin with you, Professor Shailendra. And let's start by making our viewers understand the concept of herd immunity. What exactly is herd immunity?
Thank you very much for inviting me for this show to speak about the work which we are doing with the COVID-19. And before we go to the herd immunity, it is very important for us to understand that what is the acquired immunity. The acquired immunity is established at the level of the individual, either through the natural infection with pathogen or through immunization with the vaccine. When we talk about the herd immunity, that means the immunological response of a particular person already got the infection at the level of the community or at the level of the whole society. So basically, when we talk about the herd immunity, that is the indirect protection from the infection conferred to the susceptible individual when a sufficient large population of immune individuals exists in the population. So in a scenario like COVID-19, it is very important for us to understand that how the COVID-19 will have an impact on the herd immunity, the community or the society, as well as this also depends on various factors like R0 and case fatality and infectious rate and so on, and how this will actually impact the immune response build-up in a community like India.
Okay. Okay, let's bring in Dr. Jugal Kishore here. Dr. Kishore, how would you, explain the concept of herd immunity for our viewers' sake? As in, what exactly are we looking at here?
Yeah, thank you for asking this question. And Shailendra has rightly said, there's acquired immunity which is acquired after the birth, either because of the natural infection or maybe by vaccine which we can give and get the immunity. Otherwise, we can have an innate immunity which is there, come from the mother, from to the newborn child. So this herd immunity is actually immunity which is because of you are part of the herd. That is becoming a herd immunity. Herd, like we have a community, and in the community, suppose we have 100 people, and these 100 people are mixing with each other, and they can transmit infection. Everybody have susceptibility and they can transmit infection. So what happened in between, if suppose we have 70 or 80% of people are immune, so what happened, that transmission of infection from one person to another is protected, or say not transmitted, because the immune person is there. So it is not crossing to the person who is susceptible. So the people who are actually susceptible get protected because the large number of the population is immune to that infection. That makes the herd immunity, sir.
Okay, and when we talk about the present scenario, specifically with respect to COVID-19 pandemic, why is this concept so important here, the herd immunity concept here? Dr. Jugal Kishore?
Yeah, because this is the novel coronavirus. We don't. Nobody in the world is immune to this infection initially when this was started. So because of this virus was having the infection rate is quite high and the virulence was high. So it was transmitting to one person to another through the route, which is the droplet infection from person to person very fast, because everyone was the susceptible to that infection. So it was spreading. Now, what happened once it's is infected, the person is infected. Now we are expecting, like any other infection, that this person will develop the antibodies and will become immune to this infection. So this person will not, develop again the infection. So if
Okay.
suppose we have a larger population of the world, if majority of the population develop the infection, so rest of the people will not develop the infection. So that makes the world immune to that herd immunity.
Okay, Dr. Srivastava, your views on this scientific principle behind herd immunity and the correlation with COVID-19 here, the pandemic which we are facing right now.
I think the previous expert have tried to explain it, but let us try to make it simple. Now, immunity means a type of defense mechanism or a shield which body prepares against any assault. That assault can be by a microbe. In this case, it is a new virus, COVID-19. How this shield is prepared, how this defense is prepared, is by way of invoking the immune response in the body, and by that way creating a barrier so that this type of assault by a virus does not cause harm. When it is done for a larger population in a group of persons, then it is called immunity of a group of persons or immunity of a herd. The word herd has been used by that type of herd which we see in the goats which follow a pattern and ultimately defend. So this is the basic meaning of the herd immunity. Now let us try to look at this herd immunity from the point of view of COVID-19. COVID-19, we do not know anything about this virus. It came as a novel virus. When I say that we do not know anything about this virus, it means that during the course of evolution of the disease and the pandemic, we have to learn from it, and we are learning from it. Once we are learning from it, then naturally the learning will be about the virus who is assaulting. The learning will be about the mechanism of creating a defense against the virus inside the human body of different type of groups of the person: elderly person, young person, children, pregnant ladies having comorbid conditions. This is known as a type of understanding the epidemiology of the disease. And in this course of time, we every day try to learn from it. And what we learn it, that number one is that what is the rate of transmission, how fast it moves in the society. Say, I am one person, I get infected. I am surrounded by 15%, they are all vulnerable. So if it is a very fast and very virulent type of bacteria or virus, it will infect all of them. But if it infects slowly and 4 or 5 of them are infected and protected against the virus, then it creates a small barrier for the rest of them. So this is the process of understanding of a process of immunity. Similarly, we also try to understand the structure of the virus and try to understand what is the type of vaccine we can create about it. Thirdly,
Okay.
we also try to understand what is the real treatment for it. So in this course of thing, there is a concept that diseases like this can be fought by allowing the virus to percolate in the society and thereafter giving the opportunity of persons who are of low risk to be exposed to it. So creating a good number of infected person which will act as a shield to protect the other persons. It is a
Okay.
very it is a method of using herd immunity as a tool in condition like this, but it is not being used very frequently. It is always used supplemented with a vaccine, and it is quite risky.
Okay, let me bring in Professor Saxena here. Professor Saxena, in your views, is herd immunity a good strategy to be used against COVID-19 and specifically at a stage when we do not have a vaccine against this particular disease?
See, The question of whether it is a good or bad at this moment that doesn't arises because you not have any option also. So we already have seen the lockdown for more than 60 days. We have already tried all the best procedures which can be possible for us. And we are also facing the consequences of that in terms of so many losses, either financial, personal, or even the economical or even the institutional level. Now the question is what to do, what not. Considering the scenario, the things have to be opening one by one. Before we go to the actual concept of herd immunity, we also have to understand few of the things which are very important. One is that one infected person, if let's say the herd immunity is going to play a role, that how many people can get the immunity from this particular. There have been a lot of studies worldwide has been done, and that is called in our medical terminology are not. And in that terminology, it means that what is the number of people which might get the secondary infection from the first. The studies have shown this is on an average of around 2 to 3. Let's say if I assume 3 is the value, that means the one person who is infected will give the infection to the next 3 members, and they will be the source of the immunity in that particular community. Now, considering the scenario of a country like India, where we have around 137 crores of population, that scenario, that means we need around 67% of the population to get the immunity. By that time, the cases will start declining. That means around 90 to 91 crore of the people, once they get the total immunity, then only we will see the declining of the cases. We are expecting that by December, 50% of the population might get this kind of herd immunity. But in spite of the fact, we still do not know that when actually this 50 to 67% cases will be actually having the herd immunity. Maybe at this moment, we do not have any option except that although the things are open, although the lockdown has been relaxed, but in spite of that, the people should understand they have the full risk of getting the infection and protect them as much as possible with all the possible ways which have been said in last couple of months that what are the standard strategies for protection with the COVID-19 virus.
Okay.
It's very, very important for us to understand that the herd immunity is not something, a magical ball that we roll on and then everybody will be protected against this particular disease.
Okay, definitely. Dr. Jugal Kishore, your views on this particular concept, that is the concept of herd immunity as a strategy against COVID-19, and is this the best way to go?
Uh, Dr. Shailendra has nicely described the process and also the R naught. Herd immunity is difficult to accept as method or strategy to overcome this infection just because of the reason that it has some amount of mortality. Morbidity is there, the mortality is also there. Take an example of, suppose we have a population of 1 crore, and in 1 crore, everybody says that maybe I think 90 to 98% of the population is going to have the mild type of infection. And then only just 1% or less than 1% is going to be critical and going to die. So 1% become almost, you can imagine that 1 lakh population, and we have 100 crore of population, more than 100 crore. So you can imagine that the number of deaths because of that. We cannot wait till everybody is getting infection, because it is not the death only, but the suffering of people. Mild to moderate amount of the clinical sign and symptoms are also very troublesome. So we have to delay it. So herd immunity will work. Definitely, it is playing a role. But waiting till the herd immunity reach to say 70% of the population, because many of the studies are showing 70-80%. Some of the disease have the 90% of population if immune, then only 10% get the herd immunity. So getting infection of 70 or 80% of population and then waiting for that 20% of our population going to be protected by herd is not a good strategy. You can understand this. So we have to have we have to have the measures which can delay the infection, and also seeing that how best we can protect ourselves, and also developing the vaccine as fast as possible, beside all the other measures like good quality care, and decreasing the mortality in our hospital and healthcare centers.
Okay. Dr. Srivastava, do you agree with both the other panelists that this is one of the tools, but cannot be the only tool to combat COVID-19 pandemic?
I will add further. This is not the tool which can be adopted for COVID-19 as on today. And there are reasons for it. The first reason is that this tool has been adopted by Sweden, and it has not shown substantial result because the mortality in the elderly population was quite high. Initially, UK also used this herd immunity as a tool and allow the things to progress forward. But after about 10, 15 or 20 days, they have to revert back to the public health tool of social distancing, hand wash and other things. The third country which has experimented it is Taiwan. So there are countries who have experimented it and they have found that this is not a right tool in novel virus like Corona 19. Now, second thing is that the virus is unknown and behaving very differently. In a vast country like India with a population so huge, even with the minimum fatality which we are having, that will be sufficient to overrun the public health system. You will not find bed, you will not find doctors, you will not find drugs. So this is something which will be putting the whole public health system as it exists today to a position where it will not be able to respond, and resulting in a situation of a public crisis. The third thing is we do not know how long the immunity will last, what type of antibodies it is creating. These antibodies last for whole life. They last for 6 months, they last for 2 years, or they last for 1 year. On an average, it is being said that the antibodies will last for some months to years. But the fact is that the immunity will not be provided for lifelong, like it has been seen in mumps, chickenpox, etc. So strategically, the this particular herd immunity, to conceptualize it and experiment it as a strategy for management of uh, coronavirus is not feasible. The only
Okay.
strategy which is feasible is number one, that let us try to allow the unlock moving forward with caution of the measures which we have taken, because now it becomes the civil society responsibility to follow all those type of educative material which has been provided to them. Simultaneously, put effort on building the public health system to respond to the numbers, and wait for increasing immunity as well as vaccine coming, and then the combined impact of the vaccination plus whatever type of community immunity is coming in the way will ultimately halt the process and the progression of this disease.
Okay. Professor Shailendra, combination of vaccination, once we have the vaccine and the community immunity, is the best way forward. And as Dr. Srivastava is pointing out, this doesn't seem to have worked with those nations who have tried it elsewhere.
Correct. Because this is, as Dr. Srivastava very well said, that it is very important that whether this is going to be a short-term immunity or whether it is going to be a long-term immunity. Short-term means less than 10 months. Long-term means more than 2 years. We still do not know. Not only that, it's an RNA virus, which although has an RDRP, in spite of that, the new strains might come by the end of this year or maybe by the next year. So whatever the herd immunity you might be having with this particular strain may not be exactly the same as for the next year when we are going to get the infection again. So that means there's a need that we have to do the mass serological testing to actually find out that how many individuals have been infected, how many individuals are immune, and how far we are from reaching the herd immunity threshold. And all this has to be done very calculatively. Then only we have to think that whether the herd immunity is actually going to work in our country or not. Not only that, if the reinfection happens, then after this all the herd immunity, or what you say sterilizing immunity, that everything goes into vain. And enduring the memory cells of the adaptive immune response, they, which which have to facilitate the immune control, they're also not going to play the role when a new strain is going to come in the same way as they are going to recognize these B cell or T cell repertoires. It is very important to understand that the disease and the herd immunity is very much based upon the individual capacity, and not the individual capacity, but also the virus whom we are going to handle at this particular moment. We cannot wait and watch that this particular herd immunity is going to save us for the next year as well as the 10 years down the line or further and so on. So we have to have a very clear-cut strategy that what is the cost of the herd immunity at this moment. We are planning to going to open the schools, for example, in July. And are we going let all the kids, specifically the children who are less than the age group of 15 to 16, and everybody is going to, on the name of herd immunity, going to go to the school and then they are exposed. And let's say when a single case comes to the school is going to be closed. So what is the cost of the herd immunity to that particular population? The same way, the younger population, there has been a study by WHO which shows that the 80 million kids less than the age of year one, they have the risk of getting infection. Are we going to expose them when we are going to drop these kids in the public places like, for example, child's care home and so on? So these are the various things we have to look when we are calling the staff members to the work, where we are going to drop our kids. Who is the high risk population? Senior citizens and the younger kids, or everybody in the total population, because we still do not know the correct disease dynamics in the population like India. We also have to know that where and what kind of comorbidity conditions are there, and if there is a situation like that, are we vaccinated for that? Do we have antibody titers for those comorbid conditions, at least for those vaccines and so on? So these are the couple of factors which we have to think on, where the other comorbid conditions like other organisms which might cause pneumonia-like illness, and might be there is a vaccine available for that. Are we immune against to those things? There are various factors which has to be taken into consideration before deciding that the herd immunity is going to protect us, just as a theoretical way of learning.
Okay, quite a number of variables there. As our panelists are pointing out, not only the sheer size of population, but also the fact that it becomes a burden on the healthcare system. Before we bring this to a close, let's have concluding comments from you, Dr. Jugal, Kishore, and Dr. Srivastava as well.
Dr. Yeah, Kishore? Just want to say that rightly said that it's not a good strategy, but we are learning about the virus. We are learning about all epidemiology of the infection. What is understood that not everybody is behaving or having the sign and symptom. So through that, large number of patients are there who are asymptomatic, and they are the shedder also. They are transmitting the infection in the community. We have to understand that these infections which are transmitted by asymptomatic are actually severe in nature or of a mild nature. So that is also to be understood. But what is required is that your own immunity or your own capacity of the immunity is very, very important. And that therefore, what is required in the population is that you have to develop your own system of immunity, which can be done by your good nutrition, hygiene, sleep. These are all important aspects that why not every individual is having clinical sign and symptom. So those who are actually asymptomatic or able to control the viral load inside the body, that is more important. So what is to be understood by the population is that we can improve our own immunity by methods which are natural in nature, so we can develop our own system to fight against this, and may have only just mild or asymptomatic case or infection. Okay. So that is what is required, much better than.
Okay, Dr. Srivastava, your concluding comments. Immunity is the best way forward.
I think strategically we should not deviate from the adopted strategy which we are having, and it does not include herd immunity as a strategy. Our strategy of gradually unwinding the lockdown, shifting the responsibility on the civil society so that they can adopt the safety measures, capacity building of the hospital to respond to the increasing load, and working in collaboration for public health research, like research for the zero surveillance, so that you can understand what is the value of the antibodies in the different type of high risk population and normal risk population, and partnership with the various agencies who are in the manufacturing of the vaccine, so that that strategy should be followed. And we have been, at present we are having a rising trend. This rising trend will definitely come to a halt sometime. Nobody can predict it, but once it comes to a halt, it start reversing, then we will be better informed. We may be in a better position to find out, and this herd immunity will take its own natural course. Let it take its natural course, whatever happens to it. By the time we learned about more about virus, by the time we have got report of the zero surveillance which ICMR is conducting, by the time we have got enough capacity and trained assessment of these type of things, we will be definitely able to handle the situation far better. And at present, our data provides that we have got the least mortality on account of this particular virus in India, and that is definitely a good point to record. So these are the only message I want to give.
Okay, thank you so much, Dr. Srivastava there, Dr. Jugal, Kishore, and Professor Shailendra Saxena as well for sharing your views with us. So as our panelists and experts are pointing out, we are on the right path as far as this battle against COVID-19 is concerned. Herd immunity seemingly is a good concept, but then with the variables, different variables which on which this particular concept work makes it somehow not feasible for the situation where we are right now. Becomes a burden, a large, huge burden on our healthcare system, the sheer size of the population, and some other variables as well. So the best way from here onwards is to boost your own immunity, take all the precautionary measures, specifically with respect to the social distancing norms and your personal hygiene as well. Keep watching Rajya Sabha Television. We'll bring you more details and some other topics as well tomorrow onwards. Thank you.